My name is David Szabo, and you may have seen us in the news early last week with Apple. So we have made it to the press with our collaboration with Apple's Health Group and Apple Carekit. We are the company who is introducing end-to-end encryption into healthcare apps. And so today I'm going to talk to you about healthcare, Health 2.0, and its security. Okay. So why did we work with Apple and not somebody else? Right? That's the right question. So although Apple is a huge, very widely successful company, we had 1 million targets to work with in end-to-end encryption. So let me tell you a few things. So Apple is one of the greatest innovators in Health 2.0. I don't know if you guys have noticed, but they partnered with IBM to bring digital into health. And Apple has this vastly successful developer ecosystem, and they have this big fan base of consumers using iPhones all over the place. And so Apple has the greatest impact to take this into healthcare because of their ecosystem, because of the devices, and because of the technologies that they are building in. Is it there to sell more iPhones? Is it their target to sell more iPhones? I don't think so. There's much bigger stakes here, more than just generating shareholder dollars. So what is Health 1.0? Health 1.0 is something that we all know. When you go to a doctor, and then you show up, the doctor checks you out, then they prescribe a medicine, or maybe later do a surgery. And then you're fine, you go home, you take your medicine, you take your papers, and then maybe a few weeks' time or a month's time, you'll see your doctor again, right? That's the way how it works today. Health 2.0 is going to be vastly different. In Health 2.0, patients will be part of the care. In Health 2.0, patients will be not just part of the care, but they will be in the middle of the care, using all the digital innovations today. Let me tell you an example. So here's this young lady in her 20s in California. I cannot name her. But one day she was diagnosed with this rare virus disease that put her into coma for 3 months. 3 months later, she wakes up. She forgot a lot in her own timeline. She forgot over 3 months. She forgot how to walk, how to speak. Thankfully, she could read. So once the doctors managed to stabilize her brain condition to not get any worse, the doctors prescribed her what? They tell her, okay, now you go home, take it easy, take about 2 years off, and let your brain to recover. So she went home, and what did she do? What did she do after the first few weeks of recovery? She realized that there's an iPhone in her sleeping cabinet. So she opened that iPhone and started to download apps. And she downloaded this app called Lumosity, I don't know if you guys heard about it, to start to train her brain. And then she kept using the app for weeks and months, and then she started to download more apps on her iPhone until she was at a stage where she could decide, okay, it's time for me to go back to the university and do my master's degree. So she did her master's degree. Today, she is doing her doctor's degree in School of Psychology. She's one of the top students in the class. So why did I share this story with you? So imagine if this whole process would have been driven by her healthcare provider. Imagine if she took that phone with her as part of the discharge notes. She went home, and the healthcare provider could work with her actively using the technology that is available today. And imagine if this would be available for other conditions, like heart conditions, like diabetes. There's so many sensors and tools in our applications, in our phones, that there's no way that Health 2.0 is going to be the same as Health 1.0. So this is one side of the coin. And the other side of the coin, think about those hundreds of patients that have been diagnosed with the same condition, and they accepted the doctor's advice to stay put at home for a couple of years. So Health 2.0 is going to be vastly different. And it's not going to be an improved version of Health 1.0. It's not going to be a more cost-efficient version of Health 1.0, of the same dialogue that happens between doctors and patients. It's going to be involving the latest innovations that we have invented in the past 20 years. So Health 2.0 is, if you think about it, how this is going to grow. If you think about it, how much our parents and grandparents use their iPhones and engage with us on Facebook. It's unseen. I couldn't imagine 15 years ago that my dad or grandparents would use iPhones to chat with me on Facebook. So if you think how this is going to grow, and if you think what that technology is capable to today, to put patients in control of their conditions, this is going to be a vast, big change. It's going to be huge. And there are innovations already on the market today. Apple Carekit is one of them. Apple Carekit is one of the innovators. This is, for example, how they diagnose autism. Look into the screen, look into the camera. There's a funny picture displayed. And then they look at how the child's face reacts. And they can tell you with a certain percentage of that if that child has autism or not. And this is another AI cure. This is another startup. They realize that the best way to save lives is to make patients take their pills. And they take this artificial intelligence approach of taking a photo of the patient when he takes the pill, and whether the pill was taken or not. This is a better way, and this approach has a much larger impact than if we learn how to cure cancer. So think about it. If this goes into the direction where it's going today, and this is landing as it should, imagine the number of patients involved in care. Imagine a number of patients with iPhones, with Androids and laptops. Imagine how many patients will be actively using technology to engage with their doctors and engage with their own care. So on the thought of security, because you guys invited me today to talk about security, this is just an intro. If security stands as it is today, it's not going to happen. So this great impact that Apple puts into, great effort that Apple puts into Health 2.0 in partnership with IBM, all the 200 startups that got funded last year, all the $12 billion that went into funding from venture capitals only in digital health, is not going to land if security stands as it is today. There's no week passing by without reading a data breach. I'm pretty sure that you guys get the news. Every single week there's a major data breach. And if you look under the hood, every single day there are multiple data breaches. But the media only publishes the large ones. So internet security is broken. And it's not the fault of healthcare. It's not the fault of technology companies. It's nobody's fault. That's how the internet has built up, of building individual protocols, which we call encryption and a network, encryption at rest, user authentication. They're all different technologies and they don't speak to each other. You have to solder them together, and that's where all the data breaches happen when they speak to each other. So let me go in a little more details, and I'll dedicate the second half of my talk to security. So if you look at internet security today, there are two areas of security that are broken. One is user authentication. So user authentication is the part of security where patients log in through an iPhone app. So you register, you put in your username and password, and then you log in. That's what we call user authentication. Today's user authentication services, almost every single one of them are based on hash models. So they hash your password. Maybe you guys are not technical, and hash doesn't say anything, but hash means that the actual provider who logs your users in is aware of the password. Has it ever happened to you that you accidentally told somebody else's secret to a friend? It happened to me many times. That's exactly what happens with a data breach. When the authentication service accidentally tells somebody else your password. And the hackers know what are the questions that they have to ask in order to get that answer. That's how they hack it. So user authentication is broken because of the hash-based authentication services. And this is what you read in the news every week. How many millions of passwords have been breached out? That's always the patient password. And hackers are used to taking the user passwords, because that's the easiest way. It's a really easy hack. break into the password database, take the hash of the passwords, reverse engineer it. Now you have the password. Now you can log in on behalf of that patient, and you don't have to do any more hacks. In fact, they sell those passwords in the dark web. And then somebody who knows what to do with the patient's data will use those passwords and break in. So authentication is broken today. And the second is data encryption. We focus primarily on user authentication because this is where patients are targets of breaches. So second is data encryption. And most companies, and when you hear people talk about data encryption, they talk about data encryption. But what is data encryption worth if you have a sluggish authentication service when a password can be easily breached? It's like having $1 million door and then you leave the key under the pot. You know what I mean? So the second focus of ours is data encryption. How do we end-to-end encrypt data? How do we take in the innovation that happened in the past year in the form of chat applications that we all use today, WhatsApp and iMessage and all that stuff, and use it to encrypt healthcare data? That's the second point. Data encryption is very, very, very important, but only after authentication is fixed. I think I already covered this, but this is the standard way. If you guys take one thing away from here today, is when you build Health 2.0 applications, when you decide to innovate and bring in patients to your care digitally, don't rely on your legacy user authentication systems. And I don't want to name names, but almost every single company who provides provides user authentication today uses hash-based authentication. The reason why we are different and the reason why we're in the news with Apple is because we use another technology called SRP. And I'm happy to tell you later how SRP works, but it's not using hashes. It's a Stanford-built protocol 25 years ago. It's using a different model for logging in users without storing the passwords. We don't have user passwords. So that's one thing that made us famous. We used SRP, which was around for 25 years, but nobody used it for this. So data encryption, so if you think about how many of you are using WhatsApp today? So, and probably the rest of you guys would use Allo or Viber, or if you don't use any of those, you probably use iMessage, which is iPhone's, the little blue bubbles when you send text messages with iPhone. That's iMessage. They're all end-to-end encrypted chats. Why can they not be used in healthcare or encrypting stuff that is not chat, but maybe more impactful? Patient health records or health data. So this is the second thing that we introduced in an open source SDK. So Apple and also IBM realizes that Health 2.0 is going to happen open source. It's not going to be the old school licensing deals. It's going to be open source. Let's go viral. Let's make it a toolbox to be part of the toolbox of every app developer in the world. And open source is the only way to spread it. So we did this end-to-end encryption open source and the authentication service open source too. So we introduced end-to-end encryption into healthcare, and if you look at all the innovations that are happening, if you look at just the buzzword of IoT, how many data points are collected about each of us every single day? This morning I went for my 10K run. Imagine my Apple Watch, how many data points collected. If I had a heart condition, or if I had diabetes, or something else, how happy my doctor would be to see that I'm actually moving. How many steps did I take? How long am I able to run or walk? And these are really just the basics. And then I can take blood samples of myself, and there's this vast amount of technology, this ocean of technology and data that is floating around and collecting all that data about us. Apple is just one example, and you guys all know how much data Google collects about us. Imagine if this data can be used in healthcare. So in this massive amount of data, in this whole ocean of data with all data floating around, why end-to-end encryption is only used for chats? So imagine this lady running here, how many data points we are collecting about her, and how many data points we have about her current state and whether she took her pills or not. And imagine that the doctor can see that data real time, or an intelligent platform can see that data real time and react to it. So that's what we do, and that's our mission. And end-to-end encryption is a great way to make hackers and cloud providers and everybody else who we don't necessarily want to trust, because we don't have to, see this. There's two people interacting with data. There's lots of personal data. And if somebody hacks this system, end-to-end encryption gives us the ability that attackers or cloud providers who may be accidentally telling our secret to somebody else, this will be the secret. It is really a secret. So, although we are part of this early market for Health 2.0, and although we are the ones who introduced end-to-end encryption for healthcare, for Carekit developers in Apple, and this technology is available to every app developer on Earth, let it be Android or Apple, or let it be just a web-based application in the browser. We already have companies who are working with us on it. So we already have the Diary, which is a Carekit application that is using us to run this whole discharge process and run the process in hospitals. We have Dr. Near Me in Switzerland, who is lining up patients and doctors and arranging that whole sharing of patient health data. And then we have Carekit and Liferay. They are not in the healthcare market, but Carekit does end-to-end encrypted chat with us, with your friends, and Liferay does document sharing across enterprise, and they are also in healthcare, to where you guys can upload your documents and you can work on your documents with end-to-end encryption. So Health 2.0 is here. It's in a corner, and you guys all see that. You guys all see that in our friends, in our parents and grandparents, or they're using the latest technology. Our watch is already collecting data about us. It's all there. There's a reason why over 200 startups that got funded last year. Over $12 billion venture capital spent on only healthcare startups. So imagine what these startups are going to do crazily in the next year or so to engage the whole world and engage patients to be part of the healthcare. They're not going to sit on their hands. They're going to go out there and get all the moms and pops and kids and us and everybody else to be part of their own healthcare process. So with that, I hope that answers the question, why did we go with Apple? So this is, if you think about this innovation, and if you think about all the little parts that are necessary for this, Apple is probably one of the most prominent players who have the ecosystem of developers, who have the ecosystem of developers, who have the brand, who have the patients with them, and everybody, the consumers, who have the devices and who have the size, this vast company who can do it. So Apple is one of the most prominent players, and that's why we went with them. And that's why we decided that end-to-end encryption should be part of Apple's framework. So on a last thought, if there's one thing that you guys take home is Health 2.0 happens, it's at the corner. You can be among the first companies to innovate and use Health 2.0. And if you do so, don't get security as an afterthought. Definitely use it from day one. And use the last 20 years innovations on the internet available around security, around applications, around user experience, and scale, technology of scale and clouds to do this today. Thank you.